think a good way to start this is because this is very confusing for me as well, is when people think of like dietitian versus functional nutritional therapy practitioner versus all these other things. Like, explain what you are and what it is that you do.
Yeah, it's a great question. It is very confusing, and the titles get used interchangeably, but they are different. So, a registered dietitian is you could say like the standard and conventional way to go a nutrition path. You go to college, you get a degree, you have clinicals to do, and it is a difficult program for sure. Um, I went the holistic route. Again, that's a big umbrella term. There are many different programs and paths to take on the
Yeah.
holistic route. So I went through a program called the Nutritional Therapy Association, and I'm a NTP. And what I do is I help people heal root cause issues so that they're not band-aiding their symptoms and problems
Yeah.
and really building a foundation of health
Mhm.
that will take them long term. Because what I find and what is a big missing gap in healthcare and sometimes with nutrition is trying to just plug in these tools that kind of act as band-aids. They're not really addressing the root cause. And the problem is a lot of the things driving people's chronic health issues are these foundations that are not the sexy things. They're really good sleep and a safe nervous system and a really well-rounded diet, and being hydrated and being active and strong. And that has to be there before, we should consider going down other fancy routes. So really my thought process is root cause healing. I really want to get to the root of people's healing so that they're not always every 6 months looking for the next thing. And the other thing about the term holistic is that I view the body as an interconnected system. So I help a lot of people with gut issues, and
Mm.
but I also look at their whole person, and if they're not sleeping well or they're getting headaches or they have joint pain, I want to know that too because I know
Mm.
that all these things are connected. And an issue they're having with their gut could be related to that joint pain too. So it's looking at the body as a holistic being, but
Yeah.
also holistic in the sense that let's look at the root cause and find what could be driving this.
Yeah.
Yeah.
That is, I don't even know where you begin in that journey to like start to figure out that puzzle because my sister's in school right now to be a DO, and they also have a very like holistic, very functional approach as opposed to a traditional MD, which is why she picked it, in large part. But if somebody comes to you and they go, you know, I'm fatigued, you go like, well, you've narrowed it down to a bazillion different things it could potentially be. When someone comes to you with something like that, what is your step-by-step process of like, okay, we have fatigue. What do we go from there to finding that actual root cause?
Yes. So again, I start with those foundations. So when I talk to someone that says they're fatigued, I want to know all about their their day-to-day routines. I want to know all the things. So I'm going to ask them about their sleep. Of course, we have to start there. Like, what time are you getting to bed? When are you waking up? How do you feel in the morning? Are you automatically still feeling like groggy and you could sleep for 12 more hours? And then we may go a step further and look at labs and seeing if there's any indication of nutrient deficiencies. Um, and then we look at stress too. How stressed are you? Because mental, emotional stress can have a physical toll on your body as well.
Mm.
So these are examples of looking at the foundations first. Now, somebody could also have bigger, deeper things going on. Um, I wouldn't consider either dealing with those or outsourcing those to other experts until we've done the work on these foundations. And so I
Mm.
typically, if I'm working with someone in a professional way, we'll see them for 3 months. And I want to just work on the foundations typically for those 3 months and making sure we're optimizing there before we are looking any further.
Do you look at a lot of, because there's a lot of tests out there, right? There's a bazillion blood markers you can test. There's wearables that will give you all sorts of different things. And obviously, how a Whoop tracks versus how an Aura Ring tracks a recovery score can be very different. Do you put a lot of stock into that stuff, or is it sort of like it's nice to have, or is there some things where you're like, this is definitely like we need to see this to start making an assessment?
Yeah, great question. First, I just want to say, is there a ton of background noise because they just started doing like landscaping or something outside and
No, no, it's good on
it's not
my
too bad.
end.
Okay. All right. Let me know if it gets too much and I can move. Um, but as far as testing goes, for the average person, it's kind of a nice to have, and it gives a little bit deeper insight into what's going
Hmm.
on. Um, so I do some blood testing. I typically just do pretty standard blood work. I want to see inflammation, your iron levels, how your liver's doing, blood sugar, because that gives you really great insight as it is. There's a whole world of deeper testing.
Mm.
Sometimes I run GI maps to look at someone's gut health a little bit deeper, and that'll give me a better look at bacteria and viruses, and things like markers for leaky gut and inflammation.
Mm.
So there are times I may want to look a little deeper in that way. I don't use any of the wearables. I haven't used any of them.
Mm.
I think I would love them. I just like haven't got into it. But as far as like those data markers go in testing, um, for some people, it's finding the missing piece when we can't see it physically or we're not making sense physically, like we can see something on labs.
Right.
But I like to emphasize that there is so much we can do without labs too. So especially for the person that's feeling daunting, feeling like overwhelmed, I should say, financially with how much testing you can do and pay for, I love to encourage people uh, to start. Again, I'm going to say the word foundations a million times, but start with those foundations because there are some clients in across the world, other countries that I can't order labs for because they're too
Oh,
far and
yeah.
I can't do that.
Right.
And we still make great progress by
Yeah.
just adapting their day-to-day routines, altering their diet, making sure their stress is in a managed place. A lot of people with chronic health issues are in
Mm.
this like survival mode, and even if they don't recognize it, they're like this heightened
Mm.
stress waiting for the other shoe to drop all the time. So working on that and not being such a survive in a survival mode state of being, things like
Mm.
that, the right supplements make the world of a difference. So great tools, testing and wearables. But I see it kind of as like if you're doing the foundations, that's like the next level. And there's so many levels of healing and experimentation you can go through.
Yeah.
And I'm all for those, as long as someone's also not skipping the basics that they really have to cover in
Mm.
order for like all the fancy stuff to work.
So when you got started on this, correct me if I'm wrong, but it was you got started because you had your own health journey. When you got started, did you have someone like yourself to go to, or for you, was it just, I have to kind of go through that process of like, I'm trying a million supplements and I'm every 6 months like, oh, maybe this is the issue, or maybe that is the issue, and lots of experimentation. Like, what was your journey like?
Yes, it's a great question. So I did eventually find that functionally minded physician. That was that person for me, that guiding light that
Mm.
that gave me a protocol that worked. Um, yes, I got diagnosed with Crohn's disease, a form of inflammatory bowel disease when I was 12. It kind of
Wow.
appeared out of nowhere.
Is
I
it
have
normal to get it that young?
it is a condition that you can get younger. It's not the biggest age group, but there is a good amount of IBD that is on the younger end.
Oh
Um,
my gosh.
but it is kind of crazy. You think like, how does such a young person get a chronic
Yeah.
inflammatory condition like that? And I still bewildered because I had had a very typical childhood as far as health. No injuries, no major illnesses, no
Hmm.
emotional traumas, like very typical from my perspective. Like
Hmm.
obviously something else was going on that I couldn't see. And of course there's a genetic component too, but it seemed to come out of nowhere. I had been healthy until I started getting symptoms of Crohn's. And
What were
that,
those first two symptoms?
yeah. So I remember, and a lot of them were non-GI at first. There's a lot of
Oh.
non-gut health symptoms that come with IBD, which is kind of interesting. But some of those were joint pain. I remember having joint pain in my knees, mouth sores, which is an interesting one,
Hmm.
fatigue, and then weight loss because I was starting to not absorb my food well because of inflammation. um, abdominal cramping. Like I would always have a stomach ache after eating, and I was getting full really fast. So my tolerance for food was going down. And then slightly later stage symptoms were nausea, vomiting, diarrhea, um, and those were the biggies. So there was a handful
Wow.
of gastrointestinal symptoms, and then some that seemed random, and I didn't think it any we didn't think it had any relation to it. It just seemed like, oh, joint pain,
Yeah.
playing a lot of town basketball. Like it didn't really make sense, but we're like, maybe that's it. So yeah, all those together, and then eventually getting some blood work and colonoscopy that showed the tissue was inflamed. This is a pattern of
Mm.
Crohn's. Gave me the diagnosis, and it was a moderate to severe diagnosis of Crohn's throughout my gastrointestinal tract. So pretty big diagnosis for a young person that didn't have any health issues before.
Yeah.
Um, I have a bit of family history on both my mom and dad's side with IBD, which is interesting. So, but so far I'm the
Mm.
only one of my generation to get it. But fingers crossed, hopefully that's it.
Mm.
But yeah, it was so I got that diagnosis, and then it was like 16 months after that diagnosis when I found my functionally minded physician who opened my world to the side of things. Before then, I had been on and off steroids, which helped to stabilize, my weight and slow down my GI symptoms, helped me eat more food. And I was taking some oral medications at the time. But what would happen, which is still typical for a lot of people, is coming off steroids kind of unleashes the symptoms again. So for me, it was just suppressing
Mm.
them, and it was like a crutch, and it was life saving, life altering at the time to give me back my life. But I had like 3 rounds of going on and coming off and having a flare and landing back in the hospital.
Oh my
So,
gosh.
I couldn't maintain my weight, couldn't really keep food down. I have photos of that time where I was really, really thin, unnaturally thin, because it didn't matter how much I was eating at that time, but my body wasn't absorbing the food. So if you don't have a healed gut and the tools
Ooh.
to break down and absorb food, it's not going to matter. So I kept going through the cycle of getting sick. Um, and we weren't like a crunchy holistic family. My mom was and is still a nurse as well, but she was kind of doing the poking and prodding and asking, is there a diet component here that we can look into? And
Mm.
largely she was told, diet has little to do with it. I was given a little bit of guidance, like, avoid
Wow.
fatty foods, avoid greasy foods, avoid dairy or take a lactate pill if you're going to eat dairy. It was very minimal. Eat white bread, just avoid the wheat bread. So they told me Wonder Bread was okay,
Wow.
lactate ice cream and chicken fingers versus pizza. So it wasn't super sound nutrition advice, and I did
Yeah, they
follow
told
it.
you like diet has almost nothing to do with it, and then but also here's all these dietary restrictions that you should look into.
Yeah.
Doesn't make
They
any
and they just
sense.
weren't great. They were really outdated. Um and that's where the problem was, because I did follow those and I took, the pills and everything, and I just
Yeah.
kept getting in that cycle. And
Yeah.
it's because there was a lot of things I was eating that were still triggering my symptoms. And it also wasn't really addressing my inflamed gut. So it's like if there's a fire, you can put out the fire, but then everything is covered in ashes. Like you still have to do recovery. There's still healing and cleanup that has to happen. And that's one of the areas that gets missed with healing issues of inflammation, like IBD. Um, the medications like the biologic infusions and injections are meant, the goal is that they're doing some of that gut healing, but it doesn't happen for everyone.
Mm.
It's not like popping a Tylenol or even a blood pressure medication. They just don't work the same for everyone. And so for some people, they get the gut healing. Others, it's not doing that. And so that's where like this piece that I experienced, which was healing the gut and taking this totally different approach, was the game changer for me. Within a couple of weeks, I was gaining weight back, was feeling better. It changed my life. It
Wow.
completely
Couple of
changed
weeks.
my life. A couple of weeks. Because I remember the first session I had with this physician, we had a Disney World trip planned like a month later. And we were like, we don't know if she can go. We don't know if she's going to have the energy to walk around or if she's going to be able to eat anything there.
Yeah.
And he was like, I think she'll be okay. And we started things right away. And we ended up going on that trip and, you know, got a lot of dietary modifications at the restaurants and all of that. And I had a great time. But it was like, we weren't sure at first, but I within a couple of weeks, I was having less belly aches and I was being able to eat larger volumes of food without those belly aches and
Yeah.
starting to, fill out a little bit and less loose stool. And it was just because we removed some of those biggest triggers that were just fueling the fire through my diet. And then I was adding in more foods that were good for me, as well as
Yeah.
supplements that were really helping to speed the healing along. So that experience really, really changed me. And I will say, like, I was 12, 13 at the time. I followed, my diet and did my supplements, but for years, like probably through high school, I didn't enjoy it. Like I wasn't passionate at that time when I was 14 and couldn't eat pizza like my friends were. I was resentful. I was pissed off. But I did it because I know it made me feel better. But today I do it with like excitement and I love it
Yeah.
and I love how it makes me feel. But I did it then, begrudgingly. I dragged my feet and I did
Yeah.
it until I don't know if I just matured, but in college I started getting really curious of like why do I feel so much better this way versus when I eat this way?
Mm.
And kind of saw that me having a hand in how I felt to some degree
Mm.
within a situation that feels really doomsy. It's chronic, it's incurable. But I realized that it made a huge difference in the choices that I made. And that's when I started getting more curious. And uh, eventually that led to me doing this in a professional way. But that wasn't the plan all along. I just kind of found this passion along the way.
Well, I think you hit on a big part of it, like how ostracizing it is to have these issues. I remember in high school for me, I used to basically live on like bagels and ice cream and
Yeah.
milk and just had the worst diet, but I was young and I could pretty much do whatever I wanted and I was fine.
Right.
And I had this course of antibiotics for like an ear infection, I think, or something. And like pretty standard, you don't think anything of it. And then like a couple weeks later, I had to go to the urgent care emergency room because I had this incredible abdominal pain. And my parents thought my appendix was bursting. And lo and behold, that whatever, antibiotic I'd taken had pretty much wiped out the bacteria that produced the enzymes I needed to digest lactase, like lactose. And so I could pretty much no longer stomach lactose and had developed this lactose intolerance. And next thing you know, I'm having to take like these lactate pills, which I never thought they did anything. I was like, I take one and it didn't do much. I ended up taking like 4 or 5 one time just to have like a scoop of ice cream. And I'm like, this doesn't do anything for me. But those disruptions to your gut, they really do change your life because then you don't realize it until you go through it. Like how many times people ask you like, hey, let's grab a pizza for the party, or hey, you want to go out and grab some ice cream this, it's a warm summer's evening or something. And you're like, I'll come, but I can't eat any of this stuff. And, it's not because I don't want to eat it. It's because like I'm going to suffer for the next couple days after
Yes.
eating this. It's just not going to be a good time.
Yes. It's very ostracizing, especially those years. Middle school, high school,
Yeah.
college, I felt it too. Yeah, because food is one when you're younger, especially like you like what you like and you want to eat that. But then yeah, you want to be a part of going out to eat. We also like as a society is surrounding food and that's how we celebrate and that's how we bring people together. So that can be tough as well. And like we all have nostalgic ties to food as well. So it's like holidays
Mm.
would come along and it'd be like, oh, I can't have that thing we eat every Christmas or something. And that would make me sad. So it was a hard adjustment to go from a pretty standard American diet, like a fairly healthy standard American diet, to a lot of diet changes and kind of doing the opposite of what I was doing. And definitely the opposite of what my friends were doing.
Yeah. And I think too, like, the repercussions of not sticking to your diet can be so extreme for some people, right? Like one of the things I found in my own life when you try to explain to people what it feels like to have like these joint aches or these body aches or what it feels like to have chronic fatigue or, you know, what have you, it's very hard for people who haven't gone through it to understand. And when you go to your friends and you're like, I can't hang out, like I don't have energy, I think a lot of the times they think you're tired. Like they're thinking like, pulled an all-nighter, slept a couple hours, woke up kind of tired, like in college type deal. And you're like, it's not the same because I was able to push through that. Like I could pound a coffee and I'd be okay. There's no amount of caffeine that's going to fix this problem. I have nothing in the tank. My body, my mitochondria is not producing any energy for me to do anything with. And, you know, I think for a lot of people, I know for a lot of people, like it can be very embarrassing to try to say that. And especially, it's poop, it's your gut, it's all these things. And like trying to actually come out and say to somebody, like, I'm having these issues, help me, can be very hard.
Yes, exactly. It's very hard to talk about. One, because they can be embarrassing symptoms. And two, like you said, it's very hard, near impossible, for someone to really get it unless they've been through it. I would
Mm,
always call my fatigue my Crohn's fatigue. And it was a different category of fatigue than if I did have a bad night's sleep or I went for a run and was tired. Like it was the Crohn's fatigue. I remember like if I would be laying on the couch and my mom, are you okay? Like, yeah, just Crohn's fatigue is hitting because then she would know it's like this all encompassing fatigue that, yeah, you can't really push through. It is like you get hit by a bus, but it's just, I remember telling people, I don't know, it's different. It's not the fatigue I'd get on a bad night's sleep or like a hard workout. Like this is just like a blanket that just covers you and you just cannot really push through. It's not something you can out caffeinate or something. And so that's really hard. And yeah, like with the symptoms too, I'm really lucky that I grew up with friends who, although they didn't have this condition, they were accommodating and understanding and
mm,
just really good to me. And, I'm sure there are kids out there who don't have the same experience and didn't have like very supportive friends or worse, people that made fun of things they were going through. And I'm so grateful that I didn't have
mm.
that. And my friends are amazing for that. Um, but yeah, not that I wanted to talk about like my bowel habits or get into the nitty gritty of that with them either, right? Like it's just not comfortable, especially at that age when everything is so embarrassing.
Oh, I can't imagine going through it at that age. Like right as you're hitting puberty, you got like everything's going crazy in your body anyway. And now you have this other thing on top of it. And, even from just like a health standpoint of not absorbing nutrients at that time, it has to be like looking back, that's so incredibly dangerous. You know,
Yeah.
one of the things I had read about was how, especially for girls, and like the weight of somebody affects sometimes when they hit puberty, and that the more weight they have, sometimes they hit it earlier because of the hormones and I guess the fat and that sort of thing. But like, less weight, it can prolong it sometimes. And obviously, like we see that with eating disorders and that sort of thing.
Yeah.
It's so dangerous. And like you said, like it's a young time to get it. But I also feel like we're seeing now, just in the last couple years, how many articles of this kid at 9 years old has this disease that normally they don't get till they're 30 or 40. And we're seeing it for the first time in like a 9-year-old or a 12-year-old or a 13-year-old. And it's so many different diseases. I mean, do you have any sort of like thoughts on what is happening? Why kids so young are having these issues?
It is definitely happening and it's scary. I think, and this is my philosophy with chronic and autoimmune issues as well. I think it is a cumulative thing. I don't
Mm,
think there is one driver. I do think one driver could be it for some people and some people's bodies. Like one thing is the thing that really pushes them over to diagnosis. But I do think in general, it's an accumulation of everything we're bombarded with today. It's things added to our food that's not normal,
mm,
so many additives, preservatives, pesticides,
mm,
kind of scary stuff. And especially if we're starting on that at a young age, like when we're babies. If you even look at some of the conventional, go to any regular grocery store, look at a bottle of the biggest brand name baby food or formula, I should say, that you can find. And sometimes the second, third ingredient is corn syrup and um, just not real food. Like, how is that okay, for these big food companies to be getting this in the hands of so many, you know, new parents who don't know, like that shouldn't be there because we're trusting the people who make the baby formula. But like that's crazy to me. So I think we're
mm,
hit from a very young age with a lot of a chemical um, storm, you could say, in our air, our water. You can look up what contaminants are in your town's tap water, and it can be very frightening,
Oof.
like something we take in every day in big amounts. So it's like we're hit at it from there. We can't control what's in the outside air, but we're taking in pollutants there as well.
Mm.
We are quick to diagnose antibiotics. We're quick to diagnose other prescriptions. These all are going to have an impact. Nothing we take in is really going to be neutral. It's going to have an impact, positive or negative, on the body
Mm.
in some way. And I just think today there's more of that than ever. Um, and and yeah, that's my philosophy. I think it's a
Okay.
combination of dietary, of chemicals, of pollutants, sometimes medications, pharmaceuticals, things. I just
Mm.
think it's an uh, overwhelming dose. I think a lot of
Yeah.
times we think of these things as, well, a little microdose doesn't affect you. Like people will look at things, um, a pesticide or something, and say,
Right.
well, you'd have to have large amounts of that to, I don't know, cause a GI issue or something. But also, little doses do add up. We have to remember that too. And
Yeah.
some things we don't get rid of as easy as others. So that's really important. So limiting exposure to those things is super important. But yeah, overall, I just think we're bombarded from every angle at things that our body doesn't need, and I think it's causing so much stress that it gets expressed. Our body,
Yeah.
gets confused, and then it gets expressed in like an inflammatory autoimmune thing. There's a lot of times in like a lot of my colleagues in the holistic space, we use the beaker of stress as an analogy. And this
Yeah.
beaker, everyone has one, and stress comes in all sorts of forms: environmental, emotional, um, and it adds up. And eventually, when it gets to the top and it spills over, something happens, something manifests. You know,
Mm.
it could be a physical diagnosis, an emotional diagnosis, something in your skin and your gut, but it's got to go somewhere if it's not being dealt with.
Yeah.
And so that's where I think that a lot of the new diagnoses, especially at younger ages, is happening.
So where do you even begin to like start to mitigate these things? Because I remember I read a book one time called Fatal Conveniences by Darren Olean. And one of the things he talked about in the book was, yes, like you said, like there's chemicals in makeup, there's chemicals in food, there's chemicals in this, there's chemicals in that, there's, you know, heavy metals in baby food for some reason. And all these other things, but he also points out that, you know, they are convenient to an extent. Like it is convenient to not have to have entirely organic food because for anyone who's made homemade bread for no, that stuff is good for a few days and then it gets pretty stale pretty quick. And that can get expensive. And that having bread that lives on the shelf for, a month potentially is extremely convenient.
Mhm.
If you want to be able to use your phone and watch TV and do all these things. That's very convenient. And if you're someone who's like, I want to get away from, Wi-Fi and this sort of thing, well, understand how your life is going to be different now. If you're going to cut plastic out, understand how many things have plastic in them. PVC piping, understand like how hard it is to build a house without PVC piping, if that's something you're worried about. So, where do you start with that? Because, like you said, there's some things like what's in the air that you can't really, if you're going to worry about that, you're just going to be stressed for no reason. But
Yeah.
there are things that you can tangibly do. So, what do you feel like those big things that are easy to knock off, low hanging fruit? And where do you how do you help people find that line for what am I willing to do day to day to reduce these intakes and these exposures?
Yeah, it's a great point because I know a lot of times people go down this rabbit hole, which is great because they're educating themselves, but then it gets so overwhelming because you realize how many places in your house and in your habits could be poisoning you. And it's very overwhelming. And then you feel like you can't do anything right and you kind of want to give up on the whole thing. So, my advice is absolutely to start on the big things, the things you consume and use the most, and also the things that are kind of like the lowest hanging fruit for that person. So, a couple things. I find it pretty easy to get air purifiers for the house and water
Hmm.
purifier for the house. You kind of, you set them up and you might need to change filters, but they're there and they're working in the background. So that's like, fairly low hanging fruit. Sure, you have to have the money to buy them, but they don't have to break the bank. And I, have a couple brands. I know my air filter is maybe like 200, and I feel like the water filter, the water purifier that I use too is around the same. So not crazy, but
Yeah.
things that you can buy and they work behind the scenes. So you go to get your water and it's not containing those heavy metals that we're concerned about, right?
Yeah.
And our lungs aren't getting filled with all this dust and dander, and we're keeping
Yeah.
our lungs happy, or at least when we're in the house. So things like that you can do once, and they sort of work in the background. And then when it comes to things that you use daily, like I think an easy swap is glass containers versus plastic. Another thing you can just buy once and reuse, reuse, reuse. No
Mm.
concern about plastic leaching into leftovers or anything like that. Um, Diet, of course, I think food is hugely important. So first, simply switching over to whole foods if you're on more of a, leaning on processed foods more is kind of a crutch and all of
Mhm.
that. Simply making the switch just to any whole foods, fruit, veggies,
Yeah.
healthy fats, meats,
In
fish,
that initial
eggs.
switch, do you worry too much about organic versus like inorganic, or you just like just get on to whole foods and then we can.
My bigger concern is simply just getting onto whole foods. Like that is worlds better to be on conventional whole foods than to be on processed foods because you're worried about getting all organic. So would definitely rather the whole foods. And then where it makes sense and where it's feasible for that person, because I do know that can come at a cost, and it's not feasible for everyone to find organic every
Right.
single thing. Um, but you can look at like the Dirty Dozen and Clean 15 lists, which are lists
Yeah.
that come out every year of the foods with the highest pesticide residue, and those that are safer. And generally, those have like tougher skins, so like the inside of the flesh is a bit safer to eat or less contaminated. And that's a good way to take a balanced approach of like I don't have to put all of my money into the organic produce that I can't really afford, but I can make choices with the ones that are the heavier loads. So that's an approach to take. What else? As a woman, there are a bajillion self-care products, skincare, the makeup, all of
Yeah.
it. I've mostly switched over to cleaner, and things also aren't perfect, but lower tox or cleaner products for skincare, body wash and
Mhm.
shampoo and makeup. I mostly use the brands that are striving to not use, ingredients that might have heavy metal contamination or something like that. So
Right.
again, it may cost a little bit more. I feel like I found things that aren't too pricey, but making that switch, laundry detergent or dish detergent as well, or ones that you can find good comparisons that are cleaner, less harsh. So those are some of the top, that's probably like the top 10 ish list
Mm.
of priorities that I think are the easiest to tackle and are some of the biggest hitting because we use them so much. Water,
Mm.
air, detergent, face products, like those are food, those are things we're using regularly. So that's
Mm.
kind of my approach. And it depends on the person, like someone who obviously isn't a big makeup wearer wouldn't need to worry about that. But if you've got a big family and doing a lot of laundry, maybe you really want to tackle like a cleaner laundry detergent first.
Yeah. And how do you kind of set expectations for people? Because I think when you make some of these changes, right, like you change your dish soap, it's not like the next day you're going to be like, oh, I'm not fatigued anymore, right?
Yeah.
Like there was a cumulative load that built up over time. And while some of it may have processed out, I mean, I've heard, and I don't, know what the latest on this is, but I've heard for like microplastics, for example, that this can take a couple years to really filter out of your system. And, some of these other chemicals, like who knows how long it takes to fully get them out. And if you can't even get them out without other, interventions of some kind. So how do you sort of set realistic expectations? Because people are going to make these shifts and then be like, I don't necessarily feel any different. In the same way where I feel like with food, like you said, like a couple weeks and you're like, oh man, I'm feeling it. Okay, I see this
Yeah.
is working.
Yeah. So I'll say with people that are mainly within my practice, people are mainly dealing with gut issues, but largely almost everyone has a fatigue component as well.
Mm.
I will say typically I see a lot of improvement. I'll have a session with a client and then they meet in 2 weeks for a check-in. And majority of those clients see some improvements by that 2 week check-in.
Mm.
Typically, what's most common is some of their gut issues are starting to improve. Those tend to be like, oh, I've had, if they were someone with diarrhea, they're like, oh, I'm having less bowel movement. So they're a little bit better formed, or I'm having less abdominal cramping after my meals. And some of
Mm.
those. Um, Fatigue sometimes takes a little bit longer. And that I will always tell my clients, like, okay, you're 2 weeks in, you're 4 weeks in, that's okay. But how long before were things going the way they were, right? Like, how long were you missing these nutrients? How long weren't you absorbing? So you have to understand that, like, and we have, it's helpful to remind clients of this because we all want to just feel better instantaneously. But if things were not optimal for weeks or months or years, it is going to take time for results to happen.
Yeah.
But I always say, like, any sign of improvement is a sign that your body's responding. It's being resilient. It's showing you that what you're doing is working. So if you have a little bit more energy for a couple days and then you're like, oh, on the fourth day I was kind of back to low energy, that's still really good. Like, we have evidence that your body's bouncing back and it's responding. So I'm a big supporter of celebrating and acknowledging even like the little incremental
Mm.
steps forward, because it means that progress is happening, and that's what we want. We just want to keep moving forward, even if small amounts. So, yeah, for my clients, a lot of times they're seeing those more immediate because they're changing their diet. We're using gut healing supplements, so they're feeling that pretty quickly. But sometimes they have skin issues,
Mm.
mood, stress issues, or sleep issues, fatigue, and those can take a little bit longer. It's different for everyone, but kind of just if you're seeing improvement, that's good. We're going in the right direction. It's just a matter of
Nice.
time until everything else levels out.
Cool. So I talked to a guy once at a wedding, this was a few years back, and he had worked a little bit in pharmaceuticals, and he was telling me about how I believe, had started a new company or was working with a new company, and their main focus was the gut and
Mm.
trying to, in the same way we map the human genome, map the human gut and understand like what do all there's so much bacteria that's in there, understanding what each strand does, what it needs to be connected to, all these different things. And it's obviously an enormous project, but they felt that the future of medicine is gut-based medicine, and
Mm.
that the future of treating everything from actual gut-related, more obvious gut stuff, like you said, like IBD or, whatever, what have you, to even treating flus and treating colds and treating headaches and all of this stuff could be done by treating the gut. And they're, spending millions of dollars into this. Obviously, gut health is starting to pick up right now, and it's becoming this big thing, and now people are selling more and more things. So I think what would be very helpful is, I know so many people that eventually a gut health issue hits them, and they're like, okay, what do I do? And they get online and they see, I need to eat fiber, I need to eat fermented foods, I need to eat, there's probiotics, there's prebiotics, there's symbiotics, there's spore-based biotics, like there's all sorts of different things. So for you, when it comes to beginning to address these gut health issues, what is that foundation? And then what is that next step? And, if there's anything particular you feel are like,
Yeah.
this is a big one to hit, and these ones are like, maybe avoid. I would love to hear those as well.
Yeah, that's such a great question. And I mean, that project, so needed. I agree. I think health and medicine needs to look at the gut more. I mean, it's connected to the rest of the body.
Yeah.
It's so important. So I love that project, and I think that's the way to go as well. But yeah, so someone's having gut issues. Where do they start? They could go a million places. One, adjusting your diet if you haven't before, going. I will talk about supplements in a second, but it kind of depends on what their gut issues are. But for the most part, if you're getting really bloated, or you're having some loose stool, you're getting really gassy, Going to what I call a basic healing diet or a flare diet is a good step. And what it is composed of is mostly cooked foods only. Um,
Hmm. Okay.
so, lessening raw fibers. And I know we hear fiber's great for the gut, and it is. But if you're having gut issues, I do not typically encourage people to flood themselves with fiber right away. You kind of have to wait till your body's ready for it. Oops. It can be too much. It's a good thing, but if your body's not ready for it, it will backfire on you.
Oh
So,
yeah.
oh, did you say something? I'm
No,
sorry.
I was agreeing with you.
Oh, okay, yeah.
I got one of my friends recently decided to get like a fiber supplement that they could just throw into their morning shake, and he's like, "Yeah, I just threw like 10 grams in there," and I was like, "Okay, let me
Yeah,
know, let me know how
it's
that goes."
right. It could go great or not so great, and he'll know. He'll know for sure if that
It'd
didn't
go
go great.
great. It was a lot. I think
That's a lot. It's one
he
of those
essentially
things,
doubled his daily fiber intake.
and it's one of those things you've got to go slowly, and you've just got to make sure that if you're having any underlying gut issues, you need to correct those first. So, like adding fiber, is a later stage thing for sure if somebody needs it. But first, like remove, you might want to remove gluten, especially if you know that your gut issue is inflammatory or autoimmune in nature. But even so, it can be disruptive to your gut microbiome. We know, among other things like medications and stress and environmental pollutants, that gluten is one thing that can contribute to gut permeability. It has the
Mm,
power to uh, turn the protein on that loosens the tight junctions that causes gut permeability, which can lead to a cascade of other issues. So it's a sneaky food. So if you're having gut issues, I recommend removing it, even if it's for a few months to test it out and give your gut a break, go through a little healing phase. But removing gluten, uh, only cooked veggies and minimal raw fruits, because that fiber, again, if you're struggling, your body's going to have a hard time digesting it, and that could look like loose stool or bloat or gas. Um, and so that's diet. Proteins, healthy fats, really simple whole food diet. A lot of people benefit from taking things like a digestive enzyme. I'm big on
mm.
those. I love them. I take them again. Crohn's girl. I take things to help my gut do its job, and I love them. Recently, got my boyfriend to take them. And it turns from me being like, take this, to him asking, did you take those pills with you? Do you have any of those pills? Because he can feel the difference in his gut health. And I'm like, yes, I've made it. I've transformed him. And so that's something that pretty much all my clients are on a digestive enzyme, because it's basically just giving you more of what you make yourself. But if you're having gut issues, there's a good chance that you're not making enough. There's some
Mm.
disconnect there. So a lot of times people, when they go into supplements, they kind of jump the gun, and they may take, I don't know, things like vitamin D, which I think is great, or I don't know, collagen or other stuff, which I love. But I always start with functional support, making sure the
Yeah.
gut is doing its job. If they're showing signs that they're not digesting fat, if you get a lot of nausea or pain under your rib cage, or your stools are really greasy, or they float a lot, could be a sign that you're not digesting fat well. And you may benefit from something like Tudka, or something else that helps to break down, that's a bile
Mm.
salt and helps to break down the fat. So making sure that if there are signs that we're not digesting food, that we go first to really functional supplements. So making sure that these really early stages of digestion are being optimized, because of,
Mm.
you know, digestion is a top to bottom or north to south process. And so if we're not digesting fat or digesting our food in general very well, it's
Mm.
not going to get corrected somewhere else. Like it happens here, it's not going to get
Right.
corrected anywhere else. And so that's when sometimes people get frustrated. They're like, I changed my diet. And I'm not feeling as good as I should be, but I can look at their patterns and see that, well, you're probably not making enough of this. And that's why even a really good diet is looks like your body doesn't like these foods, but there's just a functional issue going on.
Yeah.
So for supplements, it's things that help the body actually do its job, like enzymes. That's where I would start. And then I like to pair with something soothing and anti-inflammatory. And I use a lot of products that are blends, and they'll have things um, like turmeric and ginger and boswellia, super anti-inflammatory, or things like aloe or marshmallow root.
Mm.
Great for coating the gut lining. They're very soothing.
Marshmallow root.
Yes, I know. It's actually a plant. Before the marshmallows of today were created, um, that marshmallow root was is used medicinally. It's great for coating the throat, coating the gut.
Oh,
It's got like a gel-like substance in water, so it's like just a nice layer, like a nice coating. It's very soothing. It's good for coughs. Um, Slippery elm is
wow.
another one like that. If you ever heard of that, but marshmallow, yeah, originally people made marshmallows that were like healthy marshmallows. Now they're all corn syrup, but like originally they were, little, I don't know, they're probably drinking it more so than eating gelatinous marshmallows, but it's medicinal at its core, but it truly is medicinal.
It's so
Um,
crazy how many like junk foods now, like if you think about it, like they could be health foods. I think
right.
about that with ice cream a lot. Like if you took
Yes.
legit, I mean, we can get into this, like the whole like raw milk, raw kefir versus obviously pasteurized debate. But if you take either, some sort of like milk thing and you turn it into like ice cream, very good for you. There's a lot of benefit to that.
Exactly. Yeah, you could totally make a healthy ice cream. Like it is not impossible if you just use the foods in their natural form without a ton of extra unnecessary fillers, gums, sugars, all of that.
And it's still gonna taste good.
Exactly. Maybe even better. It'd probably be a richer flavor, you
I
know?
think that with pickles. I think actual
Yes.
fermented pickles are they if you're like ready for the traditional dill pickle, it's gonna have a kick to it, but I think it's way better.
Yeah, I'm sure. Yeah, it's the real thing.
Exactly.
Um,
Yeah.
yeah.
What do you think about the raw milk versus the pasteurized milk?
Yeah, I think there's something to raw milk.
Okay.
I think it's sourcing is always important. You know, if you're
Oh yeah.
it's huge. I think that's everything with raw milk. Um,
Okay.
but I think it is beneficial to have the enzymes intact in milk. I mean,
Mhm.
I am a believer that food, for the most part, comes as nature intended. And so I don't love the idea of overheating and killing and stripping things out of food because I think that's when we start to have problems tolerating the food. Um, so, raw milk, if we overheat it, we're going to kill some of the natural enzymes that come with it. And I think that's the difference for some people. I honestly haven't explored raw milk myself personally. I've been wanting to do it, but I haven't. Um, I do tolerate some dairy, but I'm just so curious about the difference of how I would feel,
Yeah.
you know? Um,
Yeah, absolutely. I mean, I feel like because I did a gut test for lactose and they were like, well, you don't have like a lactose allergy or anything like
mhm,
that. And
mhm.
so that's where I was like, okay, well, this is like a gut thing then, like, because I did tolerate it very well for a very long time. And so that's where I kind of got into, I'm like, I wonder if like small amounts of kefir in the same way, like you give a kid small amounts of peanut butter, because
Yeah.
that stuff I believe is really good for your gut. And
Mhm.
is if you can tolerate it is something that's excellent for, getting your gut into a better place. And I was wondering, I'm like, I wonder if slowly, I haven't done it yet because it's
Yeah.
the same thing of like, I feel like there's still that, I grew up, make sure your milk is pasteurized. And so I still have that, like, I don't want to be the guy who goes and tries raw milk and then gets something. And then people be like, you idiot. Like, what
Yeah,
did you
I
think
get
was going to
it.
happen? But like, in the back of my mind, I'm like, I wonder what it could do in like small amounts over time.
Yeah, I mean, I think it's a really cool experiment. And again, you find a good source, I think it's worth it. I've heard stories of raw milk being the thing that helps people clear up their eczema. You know, some people dairy in general gives them eczema, but raw dairy is something that helps clear their skin. So I definitely think it'd be a health food. Um, and I think that's the difference for some people tolerating pasteurized milk versus tolerating raw milk. I think some of the intact enzymes help you digest it. And I think, that's the gift that nature gave us to consume it. And I think it's a bit of a disservice. I do understand at a grand scale how it isn't feasible, especially if we're sourcing milk in grocery stores from giant factory. Like, yeah, probably don't want to drink the raw milk from those giant,
No.
factory farms for sure. But yeah, if you have a neighborhood farm, like that could be great. I'm also big
Mm.
on like individuality and everyone's body having different
Mm.
tolerance levels and experimenting on yourself and seeing what works for you. But in general, I'm open to the experimentation of raw milk for different individuals.
Have you seen success with healing the gut with using colostrum at all?
I haven't dug into it too much with my clients, and I've taken it once or twice. I haven't been consistent
Okay.
with it. Um, a lot of times because I'm dealing with people in significant flares, we do avoid dairy most of the time in
Mm,
totality. And then I generally, while they're working with me, will introduce some dairy and see if their tolerance is increased and all of that. But it's not something I usually start with just because I don't, want to add a potential trigger into their protocol because it is dairy derived. But I do know it is wonderful for people, and people have some great results immune system wise.
mhm.
A lot of people, including my sister, say their hair is growing faster and is better with
Really
colostrum in her diet. Yes. So really interesting
interesting.
stuff. Yeah.
I saw a company that I believe they're called True Lacta, I think is the name of this company, and they're doing human colostrum essentially,
Mm.
where they're going to breast milk banks and finding basically stuff that's about to expire and then buying it, freeze drying it, and turning it into a powder. And I don't know why that to me came off as like a weirder thing to take than like a random cow's colostrum, but it's obviously, it's human, so it would theoretically be more tailored to, the dosings and the different like immunoglobulins or whatever you're taking it for to
Yeah.
come in. But this kind of leads into a question I think you'd be a great person to ask because like you said, like some of this stuff seems to run in your family a
Mm.
little bit. A big part of birth, from my understanding, is how it affects your gut microbiome long term. And like C-section versus natural births, like can really drastically affect how your biome is built up. And so I'm wondering, and this can, this doesn't have to be based in science. This can be just your personal opinion based on your experiences. But
Mhm.
for, someone who maybe their parents don't take their health super seriously and they're just kind of like, I just do the normal thing. Um, who maybe has like some issues and has some gut issues, and then they find out their parents or their dad had the same issue and just never said anything about it because that's just how they operated. And maybe they're like, okay, I want to put my body in the best place possible, for when
Mhm.
I have kids. Or
Mhm.
similarly for yourself, like you talking about like the genetic component versus all these other things. Hopefully I'm phrasing this question well, but like you kind
Yeah.
of know what I'm getting at.
I'm
Like
following.
there's a lot of things like that factor in to it. And how much of it do you think is playing like a role of, you know, one generation is maybe pretty healthy, right? Natural breastfeeding, natural birth, all that sort of thing. And then the next generation has more toxins and stuff kind of loaded onto them. And
Mhm.
then that next generation has even more, but then they're potentially getting that passed down like that snowball effect. Like, do you think
Yeah.
that's legit, or do you think it's maybe not? And if it is, like, is there something that you think we can do about it? I don't know if that was a good
Yeah.
question. That was
Yeah.
like trying
No,
to
it's
like
a great
put
question.
together a big thought.
Yeah, I have thoughts. I'm nowhere near an expert in like really being a thought leader in this question, but I do have thoughts. Um, and it's interesting. I know an interesting thought is a woman who's pregnant, and if she uh, is having a girl, then she is growing. It's like three generations of eggs that are growing. It's hers, her growing babies, and as that baby's developing, it's if that's a female baby, then it's also developing its own eggs because females
Oh
are born with
yeah,
eggs already.
yeah.
So that thought is really interesting. That like a pregnant woman is holding like three generations of life, which is so insane to think about.
Yeah, I
Um,
thought about that. Yeah.
Yes, and I'm in the middle. I'm halfway through. There's a new Netflix documentary, and I forget what it's called, but it's all about microplastics, and it's following like six couples who are having trouble having a baby, and this
Mm,
expert's coming in, and her thing is like we're tackling the microplastics and seeing if that changes. I don't know how it ends because I haven't finished it, but they were talking about this with like the three generations and how these things can be traveling through the generations, whether it's microplastics and other environmental things.
hmm.
Um, so I do I do think there's a lot you can change in your own circumstance. So I believe both things are true. I don't think one's correct and one's not. I think, things that your parents did are passed down to you, and there are some things you can't control because, you weren't born. You can't go into their past and change it. So I think you're asking about that. And yeah, I do
Yeah.
things. Yeah.
Yeah. I had a guest on a couple of months ago who talked about, I guess, the first, like, birth is a very, I guess, detoxifying event.
Mm-hmm.
And so they were talking about how, like, firstborns generally take the brunt of the toxic load or the toxin load
Mm.
of the parent. And like it's interesting that you bring up like that idea of like if you're having girls, right? If you have a family where and this person did, I believe, where their mom was the firstborn, and I believe their grandmother was also the firstborn as well,
Mm.
that you're three generations and you're getting
Interesting.
this big dump of toxins for so long. And you said like that kind of that beaker analogy. I wonder how much that plays into, where your tipping point is of like where are you even starting and, how many people even are aware of where they're starting and how do you even assess like where my tipping point is of like if you're lucky enough to be healthy and or
Yeah.
at least not be feeling the effects of what's in your body.
Yeah. That's such a great and interesting point. I hadn't heard about that, but it makes sense of the firstborn kind of getting the brunt of the mom's detox. And like if, in holistic therapies, if someone needs to detox something, mold, heavy metals, parasites,
Yeah.
you don't do it when you're pregnant because your baby is going to be affected. So that's something you have to
Mm.
wait to do. So it's true. Like whatever you whatever you're detoxing or whatever you're holding on to can get passed on to your baby. So definitely a lot of detox going on there. Um, but what was I going to say? I think that's so fascinating about the firstborn though. I hadn't heard that before.
I hadn't heard it either, but it makes sense, right? Like if
It
you have all this
does.
built up from, however many decades of life, you brunt of it pass on, you get a lot of it out. So when you have another kid, assumingly, in the next couple of years, you
Yeah.
just don't have as much left over, so they don't get as big of a load. Whereas that
Hmm.
first kid generally will get a much because you're just starting from a bigger place,
Yeah.
right?
Yeah.
And I mean, detoxing is detoxing mold, especially how incredibly hard that can be. I have a friend right now who's kind of going through that, and I think she got SIBO and
Mm.
POTS and MCAS, and
Mm.
just found out her house has got mold in it, and she's just like, oh my God, like what am I
Another
supposed to
thing.
do?
Yeah. I
You
mean,
know?
yeah, that can be detrimental. And when it's what's in your house too, I mean, that is no small feat.
Right. And I
It's
mean, it's in the
it's
walls.
rough,
Like, how do you know? You know what I mean? You walk into the house and it looks new and it looks fine. And,
right?
I kind of assume like if you're in a house that was pre 1950, that there's probably some mold in there.
Yeah,
But,
there's a good chance.
but again, it's the stress of like if you micromanage every little thing, you just can't live your life. I
Right.
think, I think about this and this would be actually interesting to hear of like when you're setting up these protocols for people, I watch someone like a Brian Johnson where I'm like, your whole day is just a protocol. Like you don't have a
Mm-hmm.
life. You know what I mean? And so when you come to a patient, you're like, all right, these are things I recommend, and they come to you and they're like, to be honest, like, and maybe they don't do that because by the time they get to you, they're like, I'm committed to this. But like, how do you kind of strike that balance between the protocol and these things where you're like, you really need to do these things if you're going to get a result, and them being like, well, I also want to live my life.
Yeah, it's a great point. Um, it's a bit of a balance because I will always be upfront and say this absolutely has to happen. Whether it's a food you've got to cut out, the
Mhm.
supplement your body really needs, like this you have to commit to. But I always set expectations in that the first 2 to 4 weeks are going to be the hardest. I'm asking you to make the most changes that you'll experience during,
Mhm.
the time working together because we're starting from scratch. So it's going to feel the hardest to remove foods. You're going to feel the most restrictive. You're going to feel like there's more things to do on your plate. It's going to be new. That's where we have to start. But I always set up the expectation that my goal is to have them feel like this is sustainable because it has to be. And it's more about building your wellness into your routines and sometimes creating new routines, but really just making it a seamless part of your day. So it's like, writing yourself a reminder to take your supplements with breakfast, lunch, and dinner. getting comfortable in the kitchen. So it's not like, oh, I have to be a slave 6 hours in the kitchen, but how can we do some sheet pan meals and crock pot meals and things like that to spend a few hours a week in the kitchen and have stuff made. And it can be tricky. It's depending on where my client's coming from, like how much experience they have removing foods or doing protocols. Some people have more and some people have less. It feels like a bigger load. But it's about doing a couple things at a time, which is why I stretch it out over months so we can make it bit by
Hmm.
bit, kind of building on top of each other. So it's about kind of starting slow and just doing the most important things first and then refining, refining, refining. Um, and also just knowing that things are always hardest in the beginning. They're always going to feel like this is overwhelming or impossible or I'll never be able to do this. And then the cool thing is when people start to see results that they are excited about, they want to keep doing it for themselves because they feel and see the difference. So it becomes less of
Yeah.
a, oh, I have to do this. I don't know why. And then, oh,
Mm.
I actually feel the difference. Why I know I'm doing this. I'm going to keep going. So, yeah. And I think like things like being in the kitchen and cooking is a life skill everyone should know how to do and
Mhm.
should want to know how to do. It's the way to wellness and taking care of yourself. So like that that's a big piece of what I ask my clients to do and taking supplements usually like 3 times a day. Um, and other than that, having fun and having social connections sometimes as part of a protocol, like people who are in healing phases for so long kind of sometimes lose that fun connection of life because they're always focused on their health. And that's what I
Yeah.
don't want. So I will tell people, I have people who are very type A sometimes, and I will tell them, you can loosen up a little bit and step back. I actually want you not to worry about that thing. I actually want you to go have fun with your friends this weekend and have the gluten-free cookie if you really want it. Like it's fine. Um, so yeah, making your wellness feel like a job and that
Mm.
it's what you do all day is not super appealing. And it's not how I want people to walk away, like feeling like I've asked them to do that. So kind of breaking it up, um, knowing that it gets easier in time. And
Mm.
if you're doing something that is taking up so much of your day or your energy, I think some reflections in order to see like how impactful is this actually on my health and if it's not really making a difference, like just strip down to the things that are actually making the biggest difference.
Do you ever have to deal with people coming to you and being like, I was listening to the new episode of this podcast and
Yeah.
they mentioned this and I'd like to try it. And you being like, that actually has nothing to do with your current situation, but I appreciate you bringing it to me. Like, how do you deal with that? Because I know my sister's like, it's the worst for her when people come in and they've already self-diagnosed themselves and they've not even given you the opportunity to do what you're paying you to do.
Yeah.
How do you kind of navigate that space? Because obviously you are like, you're a health influencer and, putting out content, but also understanding like how that content is structured, right? Like people are posting stuff, not necessarily because it's the most in depth, but because it's going to get eyes on them, that sort of thing.
Mhm.
How do you deal with that with a patient?
Yes. So one, I always like um to kind of I guess praise them in a way or give them some props for one going out and experimenting with something. Like if they're taking a supplement already that they saw XYZ influencer promoting or heard on a podcast, and I don't think it's necessary at all for them to take, or I don't think it's going to be helpful. I like to, tell them that's great that you're out there trying things, being a self healer, self advocate, like trying different things. I'll kind of always bring them back to our main goal. And so if it's a gut health issue and they're like, I saw this and like it could help all my issues, I would just be totally honest and say, we have some more structural things to work on. I don't think your digestion's working properly. So before we introduce a
Yeah.
supplement like that, we need to make sure things are actually working. And you can, break down that supplement if you took it. Um, I do have to do a bit of that. I would say not a ton, but it does happen. And sometimes people are just curious. Oh, I saw this. Like, what do you think? And a
Yeah.
lot of times they're not bad things or crazy things, but
Mhm.
I also want to keep people's supplement loads as minimal as possible. Like I don't want anyone
Yeah.
on 30 things. Like most of my clients are on 6 supplements, anywhere from 4 to 6. And so I'll be like, if you, after they've done the proper foundational work they have to, I'll say like, if you want to experiment with that, I don't think it's going to be an issue. I don't think it's necessary for you to go spend money on it, but if you want to try it out, you can. And sometimes people just want to keep doing the biohacking stuff and they want to test everything out. And if,
Yeah.
as long as it's not going to be an issue, then I'll tell them to go for it. But they do have to do the foundational work first. And a lot of times, I don't know, whatever fancy things they're talking about is not foundational. It's more like biohacking and
Yeah.
optimizing. It's like, well, we have our work cut out for us right here. Your gut's not where it needs to be. So let's come back to that in 3 months and see.
Yeah. I think, obviously people have their opinions on the carnivore animal-based diet, but I think Paul Saladino had a great point where he's just like, if you're taking 60 supplements, are you really that healthy? Like,
Mm-hmm. Yeah.
it's a lot to do. And you can, definitely do your, I think something like cold plunge is, whatever, right? Take a cold
Yeah.
shower, that sort of thing. Easy to do. Go ahead and do it if you want it. It's not going to kill you.
Right.
But the people who get into the spending thousands and thousands of dollars and hundreds of thousands of dollars potentially to buy a hyperbaric chamber bag and to buy this full body red light suit and the vibration board and this sort of thing, and I'm like, how are you gonna use all of this
Mm-hmm.
legitimately?
Yeah.
And I think a big gap I see, I don't know if you see this as well, is like they hear there was a study done on it and then they just like assume that the product that they're buying is the same thing
Mm,
as the study without looking at like what was the dose of the study, what was the
yeah.
study on. And I see this with hyperbaric a ton,
Mm,
with people like, oh, it fixes everything,
yeah.
and it's like a one-stop shop
Yeah.
panacea. But I'm like, the stuff they're studying is at a pressure that is twice as what you're getting in these little zip up bags. So you're not even doing the same thing. You're just kind of throwing money out there, type deal. I, how do you wade through that? Because I would assume on one hand, like you have people coming in with stuff, but also, like you said, like part of your job, I would assume, is staying up to date on all of these things and sort of having that judgment of, okay, does it make sense to add this in to
Yeah.
what I'm currently prescribing?
Yeah. Um, it's a great question. So yeah, that's a really good point because whenever something comes out as kind of trendy, like a million brands will start to make it, but there's definitely a discrepancy of what's a quality product and actually going to get you similar results. And a lot of times, like you said, the studies are using so much larger dosages or strength of whatever product you're talking about. And so it's not the same in the study versus
Mhm.
actual practice. So you do have to look at that. Um, I don't have my clients do a lot of, outside of oral supplements. I don't have them get a lot of that stuff. If they already have it, I will help them figure out like if that one is actually doing what it says it's going to do. Like I will help my clients do some of that legwork. If they're like, I already have this one, do you think it works? I will do, my due diligence and help them as much as I can and see if this is something they can keep doing. Um, a lot of times I have clients who like to do all those things. They're like, I do have the red light, I have the sauna, I have the vibration plate. And, if they want to keep up with that, I will
Mhm.
say that's great. Or I'll try and help them figure out which one of those tools might be the best for them. Um, Kind of an order of importance list. I'm like, okay, that one put aside. Like, don't overcrowd your schedule to fit all of these activities in, but like maybe just prioritize that red light. Like, have it stack it with your showers. Like, do 10
Mhm.
minutes of red light and then go take your shower, and then that's good. But there is a lot of noise and a lot of things to sift through. So I'm always being asked supplements, other products. Have you heard of this? And like, no, I have not heard of this one. So I'll have to look it up. But there is always more things that are out there. And I'm just like,
Yeah.
I can't keep track of all of these new brands and their legitimacy. So it's
Hmm.
definitely takes work to dig a little bit and make sure things are worth it or not. But I think they can be good tools, especially if you're going through something really significant, mold or
Yeah.
other types of detox. Sometimes, the vibration plate and the red light can really be needle movers. Again, after someone's done the foundational work and they have their protocol in place, like those can be helpful. It's just really depending on the person and what they're going through.
Gotcha. Have you worked with like peptides or bioregulators at all?
I haven't, and I'm definitely getting questions about those right now.
Yeah, they're starting to, I believe a bunch of them are about to come hit the market again. So,
I'm curious myself as a user and a practitioner. Haven't used them. They're absolutely not my expertise yet, and I really feel that's something that if you're going to use them, you should be guided under someone who is very well
Yeah.
versed in them, and that is not me at this time. So I've gotten questions, and I think it's promising. I think there is some good stuff out there already, but it's not
Mhm.
something I'm comfortable advising on at this time
Gotcha.
to my clients or the general public.
Gotcha. It's an interesting space. And I was talking to somebody, they were explaining that I guess there's kind of two types, and that
Mm,
like the one that they feel that should be prescription only,
yeah.
that do like I believe they said like have receptors,
Mm,
and they're ones that don't necessarily have receptors, and those are more like supplements. They said that they're like these can be over the counter, they're much safer, but it's been this thing that's kind of been, I feel like, kind of gray market stuff where there was this research out of China or Russia, and you're kind of going off of these things from like 20 years ago, and like bodybuilders use it, and this or these people use it, and now it's starting to hit the mainstream because, like you said, like they're very interesting and they
yeah.
clearly do something.
Yeah.
So it will be interesting to see how it comes, but I know like BPC 157, I've heard people taking it for their gut.
Yeah.
And I've heard some people say they got a lot out of it, and then some people say I didn't notice a difference.
Yeah. 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 That's one that I've probably heard the most of. I know that one's been out there. I have had a couple clients try it on their own or under another provider they were working with. Um, and I feel like both of them were towards the end of their time with me. So I never got to hear, like, after several months, how did it actually go? But yeah, people have been curious and testing them out. I know one client recently had scar tissue, and she was working under a naturopathic physician who was having her on some peptides to see if that could improve the scar tissue, which scar tissue is very hard or near impossible if it's really there, impossible to reverse. So it'd be really interesting to see if that could actually reverse scar tissue.
Yeah.
That'd be a game changer. So it'll be really cool to see what comes up for chronic gut issues and other things,
Yeah.
of course. I mean, I'm sure it's going to change lives in many applications.
Yeah, I mean, there's another one. It's called I think it's called Stamacort, or yeah, Stamacort, and it's this it's I believe it's a bioregulator that comes from stomach mucosa,
Mm,
and apparently it does really well in supporting the stomach and gastrointestinal health, and like structural integrity and that sort of thing. But
yeah,
again, like, you hear this thing and you're like, okay, well, it sounds like a medicine, I guess.
yeah,
Like Stamacort sounds legit. But then you just get into this thing of like, where do you even buy it? How do you get it? And especially with supplements too, like, I'm sure you have your brands where you're like, I know this is legit, but there's a lot out there that if you're buying on your own, you'd have no idea what you're really buying. I
mm-hmm.
mean, I was looking at nattokinase, I think, is
Mm,
taking a big jump right now for helping with like heart stuff and blood pressure and that sort of thing. And I saw a thing that came out that they were talking about the dosing in different nattokinase supplements. And there was one, I think it was Toku, that has already a very high dose of like 10,000 plus FU units for this, which is a pretty high dose of nattokinase.
mm-hmm.
And the actual dose in it was almost twice as much. So you're actually getting closer to 20,000.
Oh,
Right.
oof.
So it's like, maybe you take half of a one, you're
Yeah.
getting what you're looking for. But some of these, like you said, you're getting twice the dose. And, I'm sure for like vitamin D, that's not the end of the world. But for like we're talking about a fiber supplement, if you think you're getting five and you're really getting 10, and you're like, all right, I'm going to take two scoops, and then you got 20, that's not going to be a good day at the office.
Yeah. Yeah. And like the supplement industry in general is a whole other topic too. And yeah, discernment and doing research, it's hard, and it's discouraging that you hear things like this, and this is not new, that a
Mhm.
product is tested and like what they say is in there is not really in there, or there's more stuff in there that you didn't think were that you don't want in there.
Yeah.
So yeah, issues with clarity and potency and the dosage, unfortunately, is a thing. But yeah, that's another reason to be more discerning
Mhm.
with different brands. And I certainly have some that I use a lot. Um, but it's a concern. Yeah, you have to be really diligent when you're gonna explore supplements on your own and really do your research.
With gut health, when it comes to men and when it comes to women, this is one thing that really fascinates me is
Yeah.
just how different the bodies are, but how similar they are at the same time. And I've kind of been learning more recently about, hormone cycles and how women's hormones obviously work out over a bigger period and men's are more on that 24-hour cyclical cycle type deal. How does that play in? How do these biological differences play into when you're trying to treat someone's gut issues? Is it a
Yeah.
big concern, or is it just like another factor in trying to delineate between, where is your symptom coming from? Why do you feel fatigue? For a girl, if is it have to do with what stage of your cycle you're in, or is this, from your gut, or is it pretty much like we talked about, just like everything kind of comes back to the gut in some respect?
Yeah, there's definitely an element of the menstrual cycle impacting gut symptoms. A lot of people with IBD, when their period's approaching, they feel like their gut gets more active. And through
Hmm.
their period, they get a little bit more active. So I would say that's a factor for sure. Um, as a practitioner, I mean, this is less like biometric and more as an observation as a practitioner. I work with a lot more women than I do men, but I do
Hmm.
see men. But I just they come to me in smaller numbers. I think I just because, my Instagram following, my TikTok following is like 85% women. I think it's just like for that reason I don't market to only women. But with the men I have seen as clients, I will say that men are less tend to be less um, open to sharing and talking more about things that could be challenges in their way. So again, not a
Hmm.
biometric thing, but women tend to be more, maybe it's because they're talking to another woman and it's
Mhm.
just a different dynamic, but there's more clarity on like what other components are impacting the gut. Like women will be more open about their stress or like a poor night's sleep or something's not really going well. I would say a lot of men are kind of just like things are okay, or this isn't great, but I'm fine. And it's harder to kind of figure out what in like more of their lifestyle maybe is impacting their gut. They're just less expressive, I think, and a little bit less open. I mean, I've had some male clients who will share everything and take really great notes, but it's definitely something I've noticed as like a gender comparison working with men and women is
Hmm.
that there's just a little more gray area, a little bit more mystery when I'm like, what else could be
Interesting.
going on? I have to do a little more digging. Uh, but yeah, women, I just feel like we'll chat more and just be a little
Hmm.
bit more open with their symptoms. Again, I'm talking about gut health, so maybe there's like, things men don't want to talk about more so than women. I don't know. I'm not really sure. But yeah, as far as like healing their gut, I take the same approach.
Okay.
Um, I take the same approach. They generally need the same things. Women just might have more considerations if their gut tends to get more active, like around their period. We may just um, up some of their supplements to support them through that.
Mhm.
Make some dietary modifications, while they're on their period to support them through that. Um, but for either of them, I want to look at their labs, make sure dietarily they're getting what they need. A woman who's wanting to get pregnant in the next year, like we're taking an extra good look at her nutrient status and kind of looking ahead to that, make sure she's absorbing everything so that she can have enough for herself and for her growing baby. So those are a couple of different considerations, but still the same template for both men and women.
Gotcha. With the guys, do you see like a difference in what the issue they're coming to you with is, or does it seem to be pretty consistent kind of across the board with what the prognosis seems to be?
Yeah, pretty similar, I would say. Yeah, I mean, because I work with such a narrow niche of people,
Hmm.
um, there's a wide scope of symptoms and issues, but there's a ton of overlap. Um, so I feel like for the most part, they're coming with similar complaining of the same things, experiencing some of the same things,
Hmm.
and making a lot of the same changes, helps them both. So I
Gotcha.
haven't I haven't seen a ton of difference, I would say.
Have you seen a difference, like a change? Because you've been doing this for, I believe, what did you say, 8 years, almost a decade.
8 years? Yeah, it's 8 years now.
You've been doing that. So you've been doing this for a hot second. Like, have you seen a change in what the primary issue is that people come to you with, like nowadays versus 8 years ago?
Mm, that's a great question. I love that question. Um, I would say today versus 8 years ago, a lot of people are they're a little bit more wellness literate because it's become so trendy and because it's so much on
Mm.
social media, which is a great thing. So people, when I started, for a lot of people, obviously not everyone's like this, but it was more of a big daunting task to change your diet or to go gluten free, which most of my clients go gluten free under my protocol. So like that doesn't sound as crazy today because it's so much more well known. Every year it's getting more well known, like certain, dietary approaches and things like that.
Yeah.
So I will say people will come to me a little bit more, have already done some experimentation, which is great. I'm not sure if it's increased, but it's still very evident that stress and overwhelm is a big driver of symptoms, um, and having symptoms be chronic.
Mm.
A lot of times, like people have said, okay, I've already started removing foods. Like again, it's very common to know that okay, food eliminations are probably part of this, and people start to do that on their own sometimes. But the stress component is a bigger mountain and much harder to change and change long term. Um, so I don't know if it's different or more stress now, but I do see that as like, okay, it's a common theme through
Hmm.
most people.
Interesting.
Yeah.
How much do you take intuition into account? Like the person's own, I think this is what the problem is when they come to you.
I do take that to heart a bit. Because I think sometimes we all just have that feeling about ourselves, and I think it's a good guide. I think
Mm.
it's always worth listening to someone's intuition about that. Um, like sometimes clients will even say, I just have a feeling that eggs are just not my friend right now.
Mm.
And, I don't have anything obvious that's pointing me to that, but I will say follow that. Let's not eat them for a week and see if that makes a difference. Because I think we all do have those intuitive nudges, and you don't need to be a practitioner to have
Mm.
that. Sometimes when someone's been sick for a long time, that intuition gets kind of fuzzy and it's hard to read the intuitive signs. Like if every food is
Yeah.
feeling like a trigger or you're always tired, you never feel well, you really start to forget what it is like to feel well.
Yeah.
So you kind of lose your guiding star and you don't really know. And so in that case, it's like, listen to your body, follow your food cravings. It's not always the best advice for someone who's been sick for a long time because there's a lot of confusing signals happening,
Yeah.
and they're kind of living in survival mode and not getting the true accurate reads on themselves. So, but after a little bit of healing, that comes
Mhm.
back. I honestly, a win that I feel like a lot of my clients have gotten is when they start quite sick or in a flare up and they end. And one of the things I say is like, you've developed a really good intuitive sense about yourself. Like you can listen to your body and you can make the necessary changes and you know what your body's telling yourself. And so they've redeveloped that sense to like tap into knowing what their body's saying because they've kind of removed
Mm.
the noise and they've cleaned up their health a lot. So they're not getting all those
Mhm.
confusing signals all the time.
Gotcha. One thing I would love your opinion on is I'm very fascinated by some of the recent research that's been coming out about how like keto diets seem to be able to treat a large number of mental health disorders,
Mm,
like remission from schizophrenia in some cases and management of symptoms. I see so many kids now. I to coach some hockey for fun,
yeah,
and
nice.
the young kids today versus when I started coaching, which was like 10, 11 years ago, if I was going to sit down and explain a drill, I had probably 2, 3, 4, 5 minutes. Like they were going to sit down, lock in, and watch. Nowadays, like half of these kids can't pay attention.
Mm,
And half of them, the biggest issue in trying to coach them isn't their technique at all. So many kids just have like anxiety about
mm,
stuff, or, they're way too hard on themselves. And goaltending coaching has become more of like like sports psychology coaching in a way where I'm like, this isn't what I was trained to do at all, but I'll give you some tips, I guess.
Yeah.
Um, Whereas before, like it just was never that way. And I feel like the gut brain axis was like that first axis we discovered. And now there's like obviously gut skin axis and there's like a gut everything axis. But I really think at the root of a lot of these issues, and I'm not saying like all of them, is gut disturbance to some degree or gut being thrown off in some way, especially when you see studies where someone gets a fecal transplant and all of a sudden their anxiety goes down and they're not feeling these cravings to eat all the time and they lose weight really quickly and all these other things get better. With
Yeah.
approaching somebody's gut health and
Mhm.
knowing how much it ties into mental health and how much mental health ties into their gut health and that mental stress is going to obviously make their gut health worse and it just becomes this endless cycle. When you get someone who's in a flare and like you said, like their foundation is bad because the gut's bad and the stress is bad, blah, blah, blah. How do you break that? Is that something where you're just like, all right, we're going to ease them out of this? Or are there cases where you're like, we just need to kind of blow things up a little bit and just stop this dead because it's spiraling out of control?
Yeah, it's a great point. And the stress and mental health piece with gut health is such a tricky one because your gut issues, especially when chronic and severe, are going to cause you anxiety and upset and stress. Like without a doubt, it's stressful. Um, but also being stressed is a trigger to your gut as well, you know? So it is a cycle. And so when you're dealing with both, they're just going to keep triggering each other. So when I have a client who's in a flare and very likely is also stressed, um, or, deals with anxiety, regularly, whether or not related to the IBD, I find that dealing with the more of the physical gut healing and alleviating some of the physical pain they're experiencing
Hmm.
kind of like gets us in the door, kind of just opens the window a little bit to eventually getting out of the difficult mental health cycle. But I kind of see it as a hierarchy of needs that when your gut, like a basic function of digestion and significant fatigue and all this is not operating, you really can't do your day-to-day activities. Like your life skills are at a minimum. You can't function. So on the, hierarchy of needs, this is very immediate that we have to tackle. We have to
Hmm.
start getting this person feeling better, not being chained to a bathroom, digesting their food. And like I just had a client who went through the program and she was in a pretty significant state with her gut health. Bathroom trips 8 times a day,
8 times a day.
up to 8 times a day using the bathroom.
Oh my gosh.
So fatigued that she would always need an afternoon nap. If she didn't, she was like, it was very difficult. She has 2 kids to get through the night. Lots of caffeine, like lots of coffee. She was really hanging on by a thread. And she had also been someone who had been on medication and SSRI for probably the last 15 years.
Oh boy.
So she,
15 years she's been on one.
yeah, a long time. And she had come off once by mistake. She ran out of medication, but she had never really fully tried to come off, but she wanted to. And so we got her gut in a place where she was using the bathroom normally a couple times a day. It's
Hmm.
formed, expanded her diet. Within at that 2 week mark, she didn't need naps desperately like she used to. And she's like, oh, I can be productive. I can hang out with my kids. So we did so much work that by the end, it was maybe like towards the end of the 3 months. She maybe had like 3 or 4 weeks left. Sorry, no, it was like at the halfway mark because she tapered until she finished. So she worked with her prescribing MD, and said, I'm ready to start coming off. And she did. And she was fully off by the time she completed her 3 months. And a big part of that is she was able to heal so much with her fatigue, her gut health that she felt stable enough that then
Hmm.
she could tackle, like she was really ready to not be dependent on those medications. And she's been doing great. She has tools to manage anxiety medication. We talk about breath work and meditation and doing things that are good for your
Yeah.
soul and make you happy. And she's done therapy and she's worked on that herself too. So it's not all in the program, but the healing that we've done in the program gave her the strength and stability to say, this is taken care of and it's not a worry on my plate anymore. that now I can really lean into my mental health and doing what I've wanted to do for a long time, which is come off this medication. And so, someone who's in a significant flare, I do where my expertise is, and I go into healing the gut. And that's what I find is like it alleviates such a stress to have your body working as it's supposed to, that then we can lean into anxiety and stress. And that's not my expertise. I'm not a mental health therapist, but I do help people manage their stress better and I help give them tools.
Mhm.
So we kind of do that after. I may give them some small homework, like building a very short breathwork practice twice a
Yeah.
day while they're doing the other stuff. But I really want to get some wins under their belt and have them start feeling good so they can
Mm.
kind of perk up, see that their body is responsive. Because a lot of people are like, I'm at the end of the rope. I don't know what to do. And it feels very doomsy, like there's no change for them because they've
Mhm.
experienced this for so long. So getting quick wins, and sometimes, like you said, that means we're going to go hard at you're really severe, we need to do a liquid diet for 5 days and then go into a
Mm.
basic healing diet. Like if I think someone will benefit from that, I will have them do that, and get the supplements in. And then when they start coming out of that funk, then adjusting where does our stress and anxiety stand. And so, certainly, like when your gut health improves, your mental health could improve just again because you're healing your gut, you're improving your absorption. But we'll
Right.
also do the, you know,
And you're
the
feeling
the
better.
strategy stuff. Exactly. Yeah, you're
Yeah.
feeling better. So it's on a couple of fronts that your mental health will improve when your gut health will. But that's how I approach it, and it seems to work well.
Ah, cool. So I think this is a good one to end on because
Hmm.
right now there's a lot of obviously change happening in HHS, and everyone's got their thoughts on it, and moving, changing the food pyramid and inverting it and doing all these different things. And one thing I haven't seen yet is when we talk about gut health, we talk about gut dysbiosis and what unhealthy guts are, but I feel like we do a very bad job of defining like what is a healthy gut? Like what does that look like? Because, just because you have like bloating after a meal one time or you have some, painful cramps after a meal one time, like that doesn't necessarily mean your gut is unhealthy, right?
No.
So if you got the call tomorrow from, Robert Kennedy and he was like, I need you to plot out for us what is a healthy gut? What does that look like? How would you define that? And what would you sort of input as like these are the big markers that every American, regardless of age, needs to be hitting?
Yeah, I think that's awesome. So, health is defined by what you see and also what you don't see. So, I would say gut health, we think of bowel movements, like having anywhere from 1 to 3 a day. This is the unfun stuff to talk about, but it's a huge marker of health. So that should be 1 to 3 times a day. There shouldn't be an urgency, like it's an emergency. We shouldn't be seeing food, undigested food in the stool. It should be a typical brown color and a formed shape. We don't want too loose. We don't want the hard bumps. So that right there, if someone's experiencing that, like big sign that their gut health is doing well. Again, something that we don't see is just as important to talk about. So regular bloating, regular gas, regular belching, regular nausea. Those would all be signs that something is off. Occasional, okay. We're not perfect. Our bodies aren't perfect. We might have a meal that's very heavy. We may have had too much of a food, too much fiber. We may have ate it while we were really stressed, which can mess up digestion, or not paying attention. Like we know, eat mindfully sometimes. The signals, the gut health connection with the brain is not really turned on if we're not turned on and tuned in. So there are different reasons why one meal you could be extra gassy or something. So it's not a write off to say that your gut health's bad if that happens. Um, it should be occasional. We're
Mhm.
talking like monthly or a couple times a month, maybe. So an absence of those sort of symptoms, I would say another sign of good gut health. I know fatigue is so broad, but if you have great energy, it is a good sign that you have good gut health. You're absorbing nutrients and putting them to work.
Mhm.
So good energy, um, What else? I mean, really everything else. Good skin health, um,
Mm,
kind of like a secondary one. Um, but I would say those are the top. I would say you just want normal bowel movements. That's a really good sign. And then an absence of things that we kind of have normalized. Like I feel like it's kind of normal. Everyone
mm.
talks about like bloating and food babies after they eat, and those things are not normal to have consistently. So let's unnormalize those and not shaming people if they have them, but just knowing like, okay, we can look into it a little bit. There's
Yeah.
something going on. But yeah, that's my good gut health, the basics, good normal bowel movements, and an absence of regular other symptoms that people kind of just get used to and think that it's their normal. And I like to tell people like,
Yeah.
yeah, what's got normal for you doesn't mean it is normal in general.
Yeah. And when we
Yeah.
talk about normal too, like how much do you think it factors in like, if I kind of feel this way when they talk about like, oh, it's, this study of microplastics didn't show a big difference. I'm like, well, if it's in everybody, how do you have a control? Right? Like if we're all
Good point.
facing negative side effects because the majority of us have had to take antibiotics at some point, or, we're all exposed to this one thing which can, alter the gut. And then it becomes like, well, everybody goes through it, right? When
Mhm.
we talk about like what is normal for a human being, assuming no outside impact, right? It just becomes
Yeah.
so hard and so like cloudy and tough to make
I
that
do
assessment.
I
I
do
would,
think today it's hard to
yeah.
make that assessment of normalcy because so much has changed. Um, we probably have to reevaluate like what
Are
is
you
normal.
big on looking back into the past? Because I feel like there can be benefit to that of seeing like what was generally thought of, but also we have to understand like their nutrition was the worst. They were eating cardboard trying to make it through the day. Like it's hard
Yeah.
it's hard to find a time where there wasn't some sort of, chemical exposure or input that could throw things off, but that also people were getting good nutrition.
Yeah, I think you have to look at it kind of with a nuanced mindset. Like things, there were some things, when we grew vegetables, like there were more nutrients in the soil at that time. That's a good, metric to look back and see how much nutrition should a carrot actually have compared to what it has
Right.
today. But yeah, there was a lot of things not great about health and nutrition, 50 years ago, 100 years ago. And when the guidelines were created for the minimum amount of iron or vitamin C, all those things that you need in a day were created.
Yeah.
They were created in mind with how to avoid illness, how to not, get scurvy or
Right,
get
right.
sick or something. So that's like an example of something in the past that wasn't great then. It's not great now. So we could reevaluate those for sure. Um, so yeah, I think, we have the most technology. We know how the body works the most today, and we'll only keep learning about that going forward. So I kind of think like being more in the present is probably the smarter thing, and use what we
Mhm.
know to create the best guidelines possible of what's normal and maybe more what's optimal. I like to talk about what's optimal because
Yeah.
again, yeah, normal. It's fuzzy. It's what is normal.
Yeah.
But optimal is probably the measure we want to look at.
Awesome. Well, I appreciate you doing this so much. This was a wealth
Yeah.
of information. If someone wants to look you up, watch your stuff, or just like work with you, where should they go?
So they could either go to Instagram or TikTok, where I'm online the most at Girl in Healing. Or you can send an email to alexa@girlandhealing.com.
Cool. And we'll include all of that. All right. Thank you so, so much.
Thank you so much for having me.